Well, onto a story I've been following for a while now, which is the plan to slug GP clinics with payroll tax. Now, new figures from the Royal Australian College of General Practitioners has revealed that 184 practices closed last year, and while others did open up, there was, in the end, a net loss of 55 clinics. Now, charging clinics payroll tax will obviously mean they either have to pass the cost on to patients or shut down. This is what I had to say when it was first announced. Now, it doesn't take an economist to work out what that will mean. You will have to pay more when you go to the doctor, so the medical centre can cover the extra cost. Payroll tax is 4.48% in Victoria and 5.45% in New South Wales. It's a fair whack, and you can hardly expect the doctors or the medical centres to absorb the cost out of the goodness of their own hearts. They're just trying to make a buck like the rest of us are. Now, going to the doctor is a non-negotiable for a lot of people, particularly the elderly who are trying to get by on the pension. And here we are in the middle of a cost of living crisis. So what do the state governments think they should do? Make you pay more for medical care. This is just cruel and utterly stupid. Well, Nicole Higgins is the president of the RACGP and she joins me now. Nicole, welcome. This has happened all around the country now. There were some court cases in the eastern states that basically decided that GP clinics were liable to pay payroll tax. And to put it very simply, what's happened here is you've got clinics where a lot of independent GPs operate. They're basically contractors. So they work out of the rooms, someone else owns the rooms, they can run their own billing regimes, whatever. They don't actually work for the clinic, they just work in it. And these clinics have not paid payroll tax on these people because they didn't think they had to. Now they're told they do. We've got clinics saying that they might have to pay $100,000 a year extra. So you either get that money out of the patient and the patient can't afford to pay it, or you look at shutting down. We've already got a shortage of GPs.
Yeah, the message it's sending is not good. And look, GPs and GP practices already pay payroll tax on our doctors in training, our nurses and our admin staff. But this is now on the Medicare that comes in. And general practices are largely very small businesses with low profit margins, 5% and under. And what we're seeing is not just hitting a bill for 1 year, but retrospective as well for up to 5 years. And this is what's killing those practices.
So you've had a net loss of 55 practices over the last year. I don't know, you might be able to tell me what that equals in terms of an actual number of GPs we've lost, but we know that bulk billing is on the slide. We know that fewer people are going into general practice. They're choosing instead to go and do specialties and whatever. I mean, what are we going to do in 10 years' time? The population keeps growing, the number of GPs keeps declining.
Yeah, so on one hand, we've got the federal government trying to reform the system and bringing in those bulk billing incentives on the 1st of November, but the state government's completely killing off any of those reforms because you can't bulk bill and pass on a charge. And if we're going to be slugged an extra tax, unfortunately, it's the patients who are the ones who are going to have to pay that. And it's a false economy.
Well, I had to laugh today because I saw the South Australian Premier, Peter Malinauskas, in the Advertiser this morning. There's one page, page 6, there's a story about exactly this issue, the number of GP clinics that have shut down. Page 7, right next to it, is a story with the SA Premier, Peter Malinauskas, saying that we understand ramping is really bad in South Australia and we want to fix it, we're trying to fix it, but we need the federal government to come on board and help get more GPs into the system, because instead of going to see a GP, people are going to emergency departments. And I had to scratch my head at the juxtaposition of these two stories, because Peter Malinauskas and Revenue SA, just like the revenue officers in New South Wales and Victoria, etc., are actively working against that aim by levying payroll tax on GP clinics. Sure, a court might have decided that they are liable to pay it, but it's ultimately up to the Revenue Office whether or not they go and charge you. And knowing how bad things are in the health system, the Premier could walk in to Revenue SA tomorrow and say, can we have a moratorium on payroll tax for doctors for the next 5 years? But they won't do it.
Yeah, so levying payroll tax on Medicare, which is, that's already been there from a levy. You're right, it is an oxymoron, because what will then happen is those ED departments will just overflow, ramping will just get worse, and the public hospital system is already at breaking point. We know that general practice has been underfunded and undervalued by successive governments over the last 10 years. This is only going to break it further, and at a time when GPs have given their guts out over COVID, we need those young doctors to come through. We don't need this messaging to say, look, actually, we're going to tax you more.
Indeed. Nicole Higgins, thanks for your time.